Okay, thank you for those who took your time to be here today, and I know more will be popping in as we get started. I was intending to live stream this on YouTube today, and I'm having some technical difficulties on my end, so I will record this, and then I will upload it to YouTube in the future. If anyone else from your organization wishes to watch the presentation today, or other organizations that you're aware of that might be interested that were not able to attend today, we did not want to make this an exclusive event, but we do appreciate all of you that were able to come in and participate in this live today. And there will be an opportunity at the end for you to share a little bit about your organization if you choose to do that. I'm going to start a presentation here, and we're just going to go through and talk a little bit about the mental health board process, and then talk about what opportunities there are for organizations to collaborate on grant proposals for this upcoming funding year. During the presentation, if you have any questions, please put those in the chat box, and we will try to address as many of those as we can. We will not be answering specific questions about the grant application, detailed things about the application today, because the application hasn't gone live yet, and that still has to be approved by the final version of the application has to be approved by the board at their December 1st board meeting. Okay. So again, today is all about convening organizations, bringing you all together, those that are in the mental health and substance abuse space, and maybe some of you that work with underserved populations, but don't see yourself as a mental health service provider, but may have access to an underserved population that is not receiving mental health services or substance use services at the degree to which they should. And so just a little history about the Mental Health Board. In fact, I'm going to actually start a little bit further back and go back to 1950, when the first psychotropic medication was used for adults with serious mental illness, called Thorazine. And there really was a paradigm shift at that point in time, because it was the first time that it was kind of believed that there could be this idea of people with serious mental illness recovering in their community rather than recovering in an institution. And so if you fast forward a couple decades after that into the 1970s, by that point, there was this growing body of research that was starting to address what were the array of supports that an individual would need who had serious mental illness to actually live and recover in their community. And so you'll see one of those models here, the community support system model, with the different services in these kind of spokes, so to speak, with that case management wrapping around the individual and connecting them to the various services. We fast forward again a few decades, and going back into the early late 2000s, 2011, I believe, was the formation of the Winnebago County Mental Health Advisory Committee, and there's been a few other committees since then. And all three of the committees that have focused on doing research into the needs of mental health needs of this community have all agreed upon two things. Number one, that we need to have a coordinated system of care, like the community support system framework models. And secondly, that we would need a local funding source in order to build that. And so that research and advocacy actually led to the formation of the Mental Health Board, the passing of the half-cent sales tax, and then the board contracted with Region 1 Planning Council, and we, along with the board, did an environmental scan of services in the area, and then developed a 3-year strategic plan, which dictates how the funding is, what types of things are being funded. And so just to give you one piece of that environmental scan, one part of it was surveying the agencies that provide service, and another part of it was surveying the residents. And so you'll see here, this is the results of a resident survey, where we've also disaggregated that data to ensure that every demographic within our population was kind of considered and that there wasn't overrepresentation of one particular group that swayed the results in a particular direction. While there's some mosaic parts of this, you'll also see some really common themes. So the green color represents an above average priority, which you'll see this kind of purple color over here, which is the traditional components of clinical mental health treatment coming in really high, green almost across the board. This light blue color over here on the left, 2 down, you'll see some green going across that, and then case management as well as green all the way across, representing above average priority. And so I'll go into the priority chart in just a minute, but for this particular funding year, there's a couple of critical documents that you'll want to review. One is the Notice of Funding Opportunity, which is posted on the website, and the other is the strategic plan. As I mentioned, the 3-year strategic plan is the document that dictates how the funding is allocated and what the priorities are. So you'll definitely want to take some time to read both of those documents if you're interested to pursue this funding opportunity. Some additional updates will be posted on the page once the actual application is approved and goes live. So back to that conversation of priorities, goals, and intended outcomes. So the top 6 priorities that were defined by that environmental scan and 3-year strategic plan. The first priority, as I mentioned, is those kind of, it says mental health treatment, but it's really like the clinical parts of mental health treatment. Diagnostic evaluation, so actually going and getting an assessment to find out if you meet the criteria for a mental health diagnosis. Supportive counseling, which could be individual, group, or family counseling. Medication management, which really, in addition to prescribing medication, actually monitoring those medications, working with clients to try to mitigate the side effects and educate them about the medications they're using. And then substance use services. And just to clarify, the board's definition of mental health includes substance use, and that is one of the target populations. In the community support system framework, it's highlighted as a separate service, but it can be, when we're talking about crisis response or client identification outreach, we're talking about that also for the people with addictions and substance use disorders. Case management was priority number 2. This is illustrated really well by that the community support system model here, because case management is really about wrapping support around that individual and helping connect them to the resources in the rest of the system. And that's kind of the gist of what case management is about in this model. Crisis response services can include actual hotline, like a 24-hour hotline. And I would say we'd probably, in an updated version, this is again from 1977, some of this research, I think now mobile ways of connecting mobily to 24-hour help would also fall under that umbrella. Walk-in crisis services, so actually in the moment of crisis, being able to go somewhere and get treatment as a walk-in. Crisis outreach services, meeting somebody out in the community where they're having their crisis rather than them coming to you. And then crisis residential, which would include that, residential non-hospital setting where somebody could recover from a crisis in a short period of time, short-term basis. Priority number 4 is family and community support. This is about educating the community about mental illness and substance use disorders, and also offering supports to the families who are living with someone who has mental illness or substance use disorder, or going through that treatment process with them. Priority number 5, client identification outreach, is really about connecting with individuals in the places where they are living or in the systems where they're already engaged, education system, primary care systems, various systems that the mental health system needs to be connected to make sure that we're catching mental illness early and intervening early in the process. And also outreach, so direct outreach, whether it's on the streets or in other ways. And then transportation assistance for people with mental illness and substance use disorders to actually get to their appointments, their mental health appointments specifically. Priority 6 is housing. And so there's two categories for this. One is supportive housing. So housing models that provide actual mental health services on site, and then residential assistance for homeless, which would be things like drop-in centers or transitional housing or emergency shelter for that population of homeless with mental illness or significant substance use disorders. Okay, so target populations then include infant and early childhood mental health, which would be that 0 to 5 age. And this age generally speaking, would not meet the criteria for a DSM-5 diagnosis. So it's defined how that can be screened and assessed in the strategic plan. I encourage you to read that section. Serious emotional disturbances, ages 3 to 5, when it becomes clinically appropriate for a child to have a mental health diagnosis, then they would fall more into this category. Serious mental illness, ages 18 and up. And again, you'll see a little bit of overlap because sometimes a child might qualify for a childhood diagnosis up to age 21. And the adult diagnoses sometimes can start as early as 18. And then substance use disorders can cover all ages. Just to note, trauma is included in serious emotional disturbances and serious mental illness. There is a specific definition of trauma that is defined in the strategic plan. One of the statements around that is that this target population includes recognizable trauma that significantly impacts functioning, but not risk factors alone. So with all of the target populations, the board's definition is really focused on functional deficits. So not just meeting the criteria for a diagnosis, but also having functional deficit from that, being impacted in social or occupational functioning. So that's really important. There's not a standardized approach to that, even among the current funded organizations. Many of them have identified their own tools that they're using in screening processes to define how they're identifying those target populations. Types of practices. This is kind of maybe was implicit to the process in the last round, but is more clearly defined now, that the board is looking to fund evidence-based practices, best practices, or promising practices. Evidence-based practices are those which are established through peer review scientific research and are considered generalizable to a large population. Best practices might have some good research in place, but they might not have a large body of peer-reviewed research. So you're looking maybe at another community that has done something and they've shown a positive impact, and they have research and some data to demonstrate that it's effective. Promising practices are a little bit more emergent and might not have a lot of scientific research specifically supporting that practice, but there might be some research that demonstrates that it's likely to be effective. So in promising practices, sometimes this can address things, emerging conditions, and allow for some innovation. And so the board is open to funding promising practices, but what I will say about it is it would not be funded at the same level as an evidence-based practice. So we would expect promising practices to be done more likely as a pilot, and something that then, if it were effective and had results over time, that maybe it could expand to something bigger. So priority tables, top 6 priorities, mental health treatment. For each one of these, we've defined the service areas, which I already went over, target populations, which we talked about, and then intended outcomes. And so the intended outcomes fall into 2 primary categories for the organizations, and then one that's more about community outcomes. For the organization, we're asking you to address how will your program improve the capacity within your own organization or within the mental health system in our community. How is it going to, for example, increase the number of providers, decrease wait times? Maybe it's providing more translation services. And then how will those improved system capacity outcomes impact the families and individuals that you serve? Do you anticipate symptom improvement, or maybe there's going to be more housing stability for the population you're serving? And then lastly, how do all of those things translate into the community impacts? And we don't expect organizations applying for funding to track the suicide rate for Winnebago County. Those are things that we want to track over time, and not expecting the organizations to do that. So priorities, we already went over the priorities, so I won't do that again, but this chart is available also in the strategic plan. Okay, and now we're going to talk about the grant process. Just to note, the board, the mental health board, makes their decisions about what they fund. We have a quorum, so majority of the board members. Last year that was 5. We have a 9-person board. Reviewed all of the grant applications, scored them according to a published rubric, which you can also find on the website. And then we went into discussions about how to strategically fund to ensure and make sure that we were building an integrated, coordinated system of care. In the last year, there was $8.8 million that was awarded, covering the top 4 priority areas. 5 and 6 are new this year, and the same target populations that were defined, we previously discussed. If you look at the funding distribution on the left, you'll see the lead organization for each proposal, and then you'll also see that on the right-hand side, the overall priorities, the top 4 priorities and how those were funded. While you don't see the priorities all equal funding, that's by intent. We did not expect that family and community services would be funded at the same level as clinical mental health services, because some of those things are lower cost. Having an event that does community awareness can reach a lot of people at a lower cost than, let's say, 12 psychiatric visits for an individual on that clinical side. When we're looking at populations served in terms of like target populations, on that top line, you're going to see based on what organizations estimated their numbers served to be for each target population, those are the proportions. And then we're comparing that on the bottom line to the actual people that live in Winnebago County by age group. So while there are more adults that will be served than children, proportionally, that's somewhat proportionate to who actually lives here. There's a lot more adults that live in Winnebago County than there are children. So, 17% was estimated to be the numbers served for severe emotional disturbance. And that kind of does match up a little bit with that 17.7% of the population being children ages 5 to 18. What is not proportional here, you'll see, is the infant and early childhood mental health, where that makes up 7.2% of the population and less than 1% of the estimated numbers served. So that is a particular population that the board is really looking at to increase numbers served this year. That is considered by researchers one of the highest return on investment age groups to serve in terms of preventing long-term chronic serious mental illness. I'm going to not go through every funded application from last year. These descriptions are all available on the website, but I do want to highlight a couple for you that were collaborative in nature, so you can get an idea of what we're talking about when we're saying organizations working together to do collaborative applications. This example here, the Children's Home and Aid EPIC program, is one where they will be working in partnership with Harlem School District to provide services on site at the school district. In this particular application, Harlem School District is not getting any money, but they are a collaborative partner in providing access and connecting a mental health service provider to the students who go to school there. So that's one type of collaboration where you're strategically partnering with another organization, but it doesn't necessarily mean that both organizations are getting paid. Maybe one organization doesn't need payment for it. They just want to help connect. Here's another example of a collaboration where all of the organizations are getting paid and they're all participating in the direct service. So this is a partnership between the City of Rockford, the Rockford Police Department, the Winnebago County Sheriff's Office, the Loves Park Police Department, and Rosecrans. And what they are doing is working together to create a mobile mental health co-responder program where if somebody is having a mental health crisis, that they are receiving a police officer who's in plain clothing with no flashing lights, and with that, a trained mental health professional who's coming out there with the officer. They also do follow-up response. They review 911 calls each day to see if maybe somebody who didn't get first response for mental health, upon further review, it looks like their issues maybe were mental health related, and then they can either follow up with that person if they're still in the community, or in the case that they had been incarcerated, they can go to their court date and advocate for them to get mental health treatment. So again, collaboration. City of Rockford serves as the lead organization, the fiscal agent for that project, and then they have a memorandum of understanding in which they issue subawards to each of these additional organizations. Okay, so that is another type of model through which collaboration can happen. And so, as I'm going through these other ones, it doesn't necessarily mean they're not collaborative. They may have referral partners they're using. It just means they don't have an agreement with another organization in their funded application. RAMP is one that has a partnership with the Tommy Corral Memorial Foundation, and Tommy Corral Memorial Foundation reached out to us last year, and they weren't sure that they qualified to be a lead organization based on some paperwork things that they were still processing. So they were able to find RAMP and connect with them and be a collaborating agency on their project, which I think both organizations would say them collaborating together has made their service that they're providing even stronger than they would have been independently. And I'll just give you one more example here on the University of Illinois College of Medicine program, which is providing re-entry. Again, it doesn't have the Winnebago County Jail as a contracted partner on the grant, but it's really symbiotic with the Winnebago County Jail's in-jail expansion of mental health services. So now you have mental health services in the jail, and then you have a place where somebody coming out of jail can have mental health services, even if they're waiting for their entitlements to be turned back on. Maybe they've been in jail for a few months and had Medicaid get shut off, and now the jail can refer them to this UIC program where they can be seen as they're, re-entering the community and becoming stable. Okay, so that was just, again, a few examples of collaborations from the past. That doesn't mean that all of the types of collaboration that you can do are limited to those models. I just wanted to present some models for you based on the last year of funding. We're going to now talk about this year's grant process, and I believe, Kristen, is that you?
Yes, it is. You can go to the next slide. Hey, everybody, I'm Kristen. It's nice to see some of you again and some of you for the first time. And I serve as grants manager on this project. So this first slide is just sort of the overall of what this year's grant process will include. So this year we have almost double the amount of funding. So we'll be up to $15 million. So there's a lot of room for folks to put forward projects. And again, the priority areas cover all the 6 that are in the strategic plan, and we already went over those. And the target populations for those of you who applied last year are the same, but with the added definition of trauma. Next slide, please. So this is the timeline for this grant process. It is available on the NOFO, and the NOFO is available on the website, which Chelsea put in the chat. So if you want to have a look at that, it's on there. And so the next big date that's coming up is December 1st, which is when the application opens for everybody. And that will happen after the board meeting on that day. When everything gets approved, it'll come up right after that meeting. We will also be releasing a grant seekers meeting, which will be pre-recorded, and that will go up on YouTube, so you can access that immediately as well. December 9th and then 17th are going to be grant question and answer sessions. You may have attended those last year. They're going to be similar, and you'll be required to pre-register on the website. Again, the links will open up as those become available, and we're still determining times, but these are the dates, the 9th and the 17th. The grant closes January 31st at 5 p.m. CST. That's going to be a hard deadline, so you got to get it in before 5 p.m. And then the board funding decisions will be made a couple months later after there's enough time to review everything on April 6th at that board meeting. And all board meetings are available on YouTube, both live streamed and then as a recording. And we spend a lot of time doing transcripts, so you can also access it that way. Finally, again, the program year funding cycle is going to be June to the end of May. So June 1st is when programs can start running.
Thanks, Kristen. Chelsea, you want to give some contact information?
Okay, yep, next slide. So if you have any questions, if you want to any other contact, you can email us at info@mentalhealth.wincoil.us. And our main website is on the Region 1. It's with our acronym. And on there, of the pages, you can see a email sign up as well. So if you want to make sure that you're in the know with updates, you can click on the website and sign up to the MailChimp. Next slide. Our social media accounts, we have Facebook and Instagram, and then YouTube. You would have to actually search our name on YouTube to find it, or you can find our links on our website. Next slide. So this is kind of just all of them in one, but then we'll move on to further. Okay. So thank you all for coming today. Next slide. We are actually going to encourage everyone to fill out an organization collaborative interest sign up. So that will be on the website. As you can see, this is what it looks like right now. So if you came here and registered today, but the next button is the sign up form. I know some of you have already filled it out. And once you fill it out, that will be available and published in essentially a database, which will be at that list. So then you can go there and see what other organizations you potentially collaborate. So this is a way for everyone to come together today, but the actual collaboration and coordinating that will be up to the organizations and involved partners. So next slide.
Thanks, Chelsea. I'm just going to follow up on what you said. So basically, the gist of that is if you are interested in collaborating with other organizations, go click that second button there on the website and sign up, and it will allow you to list who your contact information for your organization and the types of things that you're interested in, what priorities you might be interested in, and the populations that your organization serves. And then go to click that third button if you want to see then all of those organizations that have signed up. So if you're saying, yes, we want to collaborate with someone and we want to see who else is interested in collaborating, sign up first, then go to that third button and see who else has signed up.
So this is voluntary today, but if anyone from your organization would like to speak up today and kind of put forth your intent on collaborating, if you do speak up, go ahead and do your name. There we go. Name, organization, and then the type of organization that you are, and then your intended priority areas or target populations. And you don't have to commit to this as well. And whether you'd be a lead or a collaborator. Also, to reiterate, that sign up list, you can also go, once you fill out that Google form, you can actually go back and edit it. So say later down the road, in maybe a week or two, that you decided that you don't want to address a certain thing that you selected before, you can go back and you can edit that. So that will be public, but you don't have to be set in stone. So if anyone would like to speak up, go ahead and do that.
Yeah,
But the slides, oh, sorry, the slides for this will actually be on the website. So it'll actually be right under that, the list.
Yeah, go ahead and put your name in the chat if you would like to share your organization's interest in this meeting. Again, that's not required, but put that in the chat and then we'll call on you so we don't get everyone talking at once. And please limit your responses to maybe 2 or 3 minutes so we can make sure everyone has a chance. Okay, thanks. Laura Kane, Marshmallows Hope. Why don't you go first, Laura?
Hi, so my name is Laura Kane, and I started Marshmallows Hope after losing my 14-year-old son to suicide. What we do at Marshmallows Hope is we have a one-on-one mentorship program for kids 9 to 19 who are living with anxiety, depression, suicidal ideations, victims of abuse. And we also raise funds to pay for mental health services. So for counseling services, we have a few partners in the community that all of our kids in our program are referred to. And so our organization has only been a 501c3 for a year. We definitely would love to collaborate with another organization willing to help us with obtaining funding to continue to sustain the program. The program serves as a dual program. We are currently trying, we've been partnered with the Air Force. We have a trial program where we realize that servicemen and women are not going to reach out, as well as the veteran community. They aren't able to reach out for help due to the stigma. And so our program is designed to where if they're mentoring a child who has, who is living with this emotional disorder, the relationship is not only building a positive relationship for both the mentor and the child, but it's also giving the mentor a protective factor. So that if they do get stuck in that darkness and, they're contemplating suicide, their relationship with the child, excuse me, will actually keep them from completing the act of suicide. So our program is to benefit, the military community. We're trying to partner up with local law enforcement and first responders, as well, as we know that they are also at high risk due to their line of work for completing suicide. And so we, currently we are running in the local community with civilians for the program. And most of the kids that come to our program, they unfortunately have attempted already at least one time, but we have seen that, once they get linked up with a mentor and we put them into the counseling services, we start to instill, positive, just encouraging them to keep living. And we have seen like a really, really great thing happening in our community where these kids are starting to find hope within themselves and want to actually continue living. So, I would
Laura,
love.
thank you so much for sharing. It sounds
Yeah.
like you're working with some very different populations there, and some different types of services, and interested in being a leader collaborator. So thank you for sharing. Please do sign up. We've got a few more in the chat box here, so I want to make sure everyone has a chance to talk. Lori Poppin from Children's Home and Aid.
Hi, I'm Lori Poppin, Director of Behavioral Health at Children's Home and Aid. We are a traditional mental health provider agency. We don't provide substance abuse services. We work with a lot of different populations. We have a large child welfare program in our region. And we've done a lot of different types of behavioral health services throughout the years. Our priority areas are mental health treatment, case management, and family and community support. And our target populations would be, well, and I'm kind of speaking for our early childhood program as well, because we also had a doula grant through the mental health board. So I would say that for Children's Home and Aid, infant and early childhood mental health would be one of our target populations. And then serious mental illness. I'm sorry, serious emotional disturbances. And we would be willing to be either a lead or a collaborator. I think we would be interested. I don't have something really specific in mind for either of those roles, but really interested in collaborating with other agencies.
Lori, thank you so much. That's wonderful. And yes, the doula program is really exciting in addressing that early childhood population. Erin, I think Rabon, Executive Director, Circle of Change.
Hi, Erin Raybon with Circle of Change, as you mentioned. My target population are the veterans so far. We work with veterans with PTSD. We provide them with dog training and handling classes. They come in and work with dogs with issues. Our program works to build back trust and community amongst our veterans. And post-pandemic, as you can imagine, just like all of us, they're very much in need. I am looking to possibly expand our reach into working with first responders. And we're also talking about creating a special program for children. Oftentimes when the parents are dealing with PTSD and traumatic events, our kids are definitely the first ones. They're right on the front lines. And so we've seen such hope in our program. We'd like to share that also with the children of those veterans with PTSD, and possibly, again, we're looking into first responders. So, and I am very, very open to collaborating with someone, however that may look. So
Wonderful. Thank you so much for being here today and sharing the work that you do and the population that you work with the veterans. That's wonderful. Christina Gloria, Dimensions of Wellness and Transformation.
Unmute myself. I tried to unmute myself here. Hi, I'm the owner of the Dimensions of Wellness and Transformations. It's a private practice, and I'm focused. I opened my private practice having in mind to help a Spanish-speaking population, because the Spanish-speaking population is underserved since age 3 up until 100. Even though there are services around, they still have not been served in a lot of things. And opened my private practice 4 years ago. And my caseload right now is, I can say, is 75% Spanish speaking. And some of them, they come looking for services, and some of them, they don't have insurance. So I arrange with them to, it's not a sliding scale, I can tell you. Okay, it's whatever they can pay, but I have to pay my bills too, and they need services. That's my first thing. And I'm open to collaborate with other people that are willing to work with the population that is Spanish speaking. And of course, they have substance abuse, domestic violence, trauma, children, and all that, the gamut. So that's a lot to do in that area.
Well, thank you so much, Christina. And I'll just say, if you read the strategic plan and you really even look at even the other published document, which is the gap analysis or the environmental scan that was surveying the 50 organizations that responded to that. Translation services were not available at every organization, and definitely there was a lack of that service available, or the integration of that with mental health services. So really appreciate you being part of this conversation today, Christina, and hope that you find some partners to collaborate with on to expand services to that population. Thank you.
Thank you.
So no one else has signed up in the chat. Is anybody? I'll give you one last chance. If anybody else that has not already had a chance, if you'd like to, if you don't do it on the YouTube, it's okay. We still want you to go sign up on the website, and that's the way to connect with others. The mental health board is not going to get directly involved in coordinating who works together. Okay, we're creating an avenue and a platform for you to express your interest and then to independently connect with one another. We have a little bit of extra time this year. The grant application will be open for a longer period of time. The NOFO went out an entire month in advance of the application. So we created that extra time to make sure people had opportunities to identify organizations that they could potentially collaborate with. So I really encourage you to take that opportunity. You'll also find that in this year's root scoring rubric, collaboration is an actual item in there. So that gets scored as part of the grant application. So it's going to be part of the strength of, so that can be referrals, that can be how your services integrate and connect with other service providers, or that can be collaborative applications that involve multiple organizations. Okay, we'll do one more here, and then if there's no others, we'll end shortly. So Courtney Geiger, Goodwill Industries.
Hey, thank you. Thank you for also providing this opportunity for us to collaborate. I think it's really neat, and I've not seen it done before, so I'm really excited to have the opportunity. We are specifically looking at, we work with young adults, many of who have been involved with the criminal justice system and have a significant amount of trauma prior to involvement with the system, and of course, while they are involved with the criminal justice system. So I'm sorry about that, working at home and its challenges. But we would really love to partner with someone who's interested in, working with individuals and helping us provide some support services and mental health services and counseling to youth. And we're talking about ages like 18 to 25 is the target population that we work with. So would love to talk to people and brainstorm some great solutions.
Courtney, thank you so much for being here today and for expressing your interest. I really appreciate that. We have Phyllis from the Liam Foundation. Oh, sorry, no need to speak at this time, but she has made it known her interest in collaborating, and I assume will be signing up on the list as well. So again, thank you everyone for coming today. I think we had over 40 people that signed up for this, and I don't know how many unique organizations that represents, but it's just really exciting how much this community continues to show up for mental health. And it's so important that we have organizations interested in this, because we have this awesome opportunity with this half-cent sales tax. So again, we're available for questions. We'll publish this slideshow on the website as well. And I know Chelsea has shared with all of you the link in the chat for funding resources. So that's a great place to go to just get caught up to speed if you haven't already read the NOFO and the strategic plan and taken a look at some of the more details within those documents. Again, thank you for coming today. And we look forward to seeing you all at the next one that we have, which will be the question and answer session. Thanks.